Good morning, parents and families. We are really excited to have you join us. My name is Linnann Yundestead, and I'm the Director of New Student and Family Programs at Virginia Commonwealth University. We're really happy that you've stopped in for another one of our webinar series, and I've got some really great friends that I'm going to turn things over to in just a moment. But before that, I want to thank all of you who participated in Family Weekend. We had a fantastic weekend with over 2,500 parents and family members visiting campus. It was alive, the weather was beautiful. It was just an incredible weekend. So thank you for all of you who participated. And if you didn't get a chance to join us, we are going to be doing a spring event. And so there will be more information coming on that shortly. So today, my friends are going to be talking with you about counseling, health, and wellness services at VCU. And I will personally just say I am in need of some of these services right now because I have been moving over the last 24 hours. That's why you see these lovely U-Haul boxes in the corner here. And I'm stressed, I'm not well, and I think I might be getting sick. So I'm going to be hitting up some of these friends shortly for some tips. But for now, I'm going to go ahead and turn things over to them. And they'll introduce themselves and get started. And as always, we'll make this recording available on our blog and our family Facebook page. And so if you ever need to refer back to the content, you're welcome to do that. All right, y'all, take it away.
Thanks, Linnann. Well, I'll introduce myself and then I'll let my colleagues introduce themselves. I'm Jihad Aziz. I'm the Interim Executive Director for Health and Wellness and the Director of University Counseling Services.
I'm Margaret Robertson. I'm the Director of Student Health.
And I'm Lisa Joyner. I'm the Director for the Wellness Resource Center. And today we're going to jump right into our topics covering counseling, health, and wellness. And so, Dr. Aziz, you have the floor.
Yeah, well, thank you. Well, thank you for the opportunity to talk about some of our services here that we have at University Counseling Services. So our offices are located on the Monroe Park campus as well as the MCV campus. One of the great things about having two offices is that we can have students go either place and get appointments. So it really provides lots of opportunities for students to be able to schedule at different times. One of the benefits of our medical campus office is that we have 2 evening hours, so Monday and Tuesday. So students who might have a busy day, lots of classes or a work schedule can still have opportunities to see a clinician, and we'll be able to provide them the services that they need. So just talking about services in general, one of the things that we try to do is have all students come in who are interested in the service to meet with a clinician so we can make an assessment about what's the appropriate level of care for them. One of the things that we found out is that lots of students don't necessarily need therapy, but they need particular skills. So a few of the services that we offer is like individual psychotherapy, group therapy, as well as our anxiety management group, Reclaim. We find that a lot of students benefit from learning the skills about how do they manage their anxiety. And we know that this time of year, right around October, is a time that lots of students are feeling overwhelmed and there's a lot of stress going on. They need to figure out how to cope. There's lots of things that are new to them. There's lots of transition and change. Midterms are coming up. So there are a lot of things that they're struggling with that, sometimes they just need skills. And our goal is how do we provide that? The other thing is that one of the things about our services is that we provide brief individual therapy. So we have a short-term model. We don't do long-term care. So if a student needs longer-term care, maybe throughout the semester or for a year, once a week therapy, we have a clinical case manager on staff who helps the student get connected with resources in the community. So those are just some of the, a brief overall view of some of the services that we provide. Another thing that we do is we do a lot of outreach and prevention programs. So we recently did, Suicide Awareness Month. We have Safe Zone programming. We have discussion groups for international students. So we do a lot of outreach programs because we're really about prevention. So we really want to get out there ahead of the game and help students sort of recognize if they're struggling with something. Here's how do you get resources, and here's where you can get support. So our goal is to really sort of connect students with resources on campus or with the University Counseling Services, depending on what they need. So we really try to do a thorough assessment and then make sure we get students connected with the right resources to support them. One of the things that we have available is the crisis services. So during business hours, If a student walks in and says they need to speak to someone, or they're having thoughts about hurting themselves or someone else, or has recently experienced a traumatic event anyway, a death of a family member, any of those things, they can walk in and we'll see them. I mean, we see people within 10 minutes, 15 minutes after they come in to try to make sure that we provide them with the support that they need to be successful. We also provide, if we click to the next slide, after hours. So I tell people, we're available 365, 24/7. So if a student is away during a winter break and the university's not open and they're having a mental health crisis, we have a clinician that's available to talk to them, to be able to consult and figure out what the next steps are and how can we support them. All they would have to do is call the VCU police at 828-1234 and ask to speak to the counselor on call. And then that way we would have somebody available to support their students. So we really try to provide a holistic sort of service, sort of wraparound, sort of what are we doing during the day as well as the evening, as well as how do we get them connected to different resources. Because again, one of the things I like to articulate is every student who comes in doesn't necessarily need therapy. Some need just a few words of support. Some need, opportunities to learn coping skills, and some need more therapy. And then we are able to provide that within the short-term model. And I'll turn it over to my colleague, Dr. Roberson.
Thank you, Dr. Aziz. So I'm going to give you a brief overview of the services we have at Student Health. We also have clinics on each campus. On the Monroe Park campus, we are located by the Siegel Center. We do have parking behind the clinic, which is very nice for our students. And on the MCV campus, we are over in the VMI building. And actually, that's the same building that the Counseling Center is in on the MCV campus. We do have comprehensive primary care services available for our students. We also have an in-house pharmacy, and we have lab services on each clinic. Next slide. We do provide appointments both online and by phone. Non-urgent appointments can be scheduled online. They are limited in number, so you may need to call for an appointment if it's not a convenient time for you. We do like all urgent appointments to be scheduled by phone so that we can determine how soon someone needs to be seen, and we do provide a lot of same-day urgent appointments for that reason. All full-time students pay a semester health fee. This covers all their care provided for that semester. Students are responsible for the cost of medications and certain labs, but pretty much the entire visit will be covered when you pay that health fee. We do encourage all students to have health insurance, though, because there are services that are not covered, for example, x-rays or referrals to specialists. Next slide, please. Our services, as I mentioned, are comprehensive primary care. We do manage both acute and chronic illnesses, and we do provide preventive medicine. We are nationally accredited by the Accreditation Association for Ambulatory Healthcare, and this past year we received a full 3-year reaccreditation, which I think is really a testimony to the high quality care that we provide to our students. Our immunization department is one of our busiest areas in the clinic. We offer free flu vaccine, and we can also help students get free or discounted HPV vaccine series. Each full-time student is required by state law to meet certain vaccination standards, and so they are not allowed to register for their second semester until they have provided proof of all these vaccines. We start sending warning emails early on in the semester to our students who haven't submitted all the necessary documentation, and they can go on our website to look for our immunization hours, where we offer walk-in hours pretty much every day of the week. And the students need to complete these so they can register for the spring semester. We do also offer mental health services. We work closely with both the Counseling Center and the Wellness Resource Center. Our primary care providers can take care of our less complex patients, and we're fortunate that we do have staff psychiatrists that can help us with the more complicated patients who need to be seen. Next slide. Thank you. We do provide travel medicine. We do recommend that students who are going to travel to schedule an appointment at least 6 to 8 weeks ahead of time. And that's because there's certain vaccination series or certain medications that need to be completed to provide the utmost protection before you travel. The travel medicine clinic is free, but the students are responsible for the price of prescriptions or for any vaccinations that are recommended. We do have an Insight Pharmacy, as I mentioned. It's located on the Monroe Park campus. It is an independent pharmacy, so we are able to keep the medications at a very reasonable price. Students can purchase the medication and submit to their insurance company for reimbursement, And we also have a lot of over-the-counter medications that are very inexpensive. Students do not have to be seen by a provider to take access to the over-the-counter medications. These are available when the pharmacy is open every day, and we have brochures outside the pharmacy on each clinic to let them know what is offered for sale. So thank you.
And once again, my name is Lisa. I'm the director for the Wellness Resource Center. And today I want to tell you guys a little bit about who we are and how your students can access support services and resources that we provide. And so we're located on the Monroe Park campus, but we do also service the MCV campus as well. We're located at 815 South Cathedral Place. It's a couple buildings away from the Student Commons and a little bit adjacent to the Cabell Library. Students, faculty, staff members, and parents can call us at our phone number at 804-828-9355, or they can email us at thewell@vcu.edu. Our staff are really put in place to really help your son or daughter or family member be successful throughout their time here at VCU. That's looking at health education opportunities. You'll notice we have a wide variety of staff members who really focuses on different areas. So we have a staff member, for example, a health educator who focuses on alcohol and other drug education. She's out in the campus community. She's talking about serving sizes, what it's like to really consume, what does that look like for each individual person, and how alcoholism also affects individuals as well. We also have our holistic health educator, Mia Liatis, and she focuses primarily on mental health, really looking at stress management, and we'll talk a little bit about a program that she runs a little bit later. We have our community engagement coordinator who's really out on campus doing big wellness fairs. She's making collaborative ties. She's really out there to support your student. And so if they see her, definitely make sure they say hello and how can we assist them. We also have our associate director of the Wellness Resource Center as well, and she's really there to engage with your student, to really say what are your needs, how can we help you, and what are some areas in which you may want to get involved. Carrie Baines, and this is a great program that we have, is our peer health educators. We have a total of 45 students who really help us push out that health education information. And so as we're transitioning through the academic semester, we hope that your son, your daughter, your family member reaches out to really figure out ways in which they can engage with our office, but to really learn more about their overall holistic health. Lynanne, can you go to the next slide? Some of the services that we offer are alcohol and drug education, which Kendall oversees. We offer programs known as Basics and K6, really looking at alcohol and drug consumption, also looking at cannabis because that's a hot topic right now. We also oversee our TIPS program, which is Training Intervention Procedures for a University, and it's going over an overall assessment of alcohol education, drug education, usage here at college, so students can see what are their peers doing, what is VCU doing, and then how can we support them. As you may or may not know, as of July 1, VCU is a tobacco-free campus, and so the Wellness Resource Center, along with other campus partners, are offering tobacco cessation appointments. Students can go online at thewell.vcu.edu and fill out an appointment time slot. It's free of charge. We help them throughout their journey to quit smoking, vaping, juuling, and other things that they may be doing. This past academic year, we also opened our Resilience Lab, and Mia Liatis oversees the Resilience Lab. It's focused really on stress management techniques, building that resilience, because like Dr. Aziz said, every student does not need counseling. So how are we building resilience for students? We also have mindfulness sessions that students can attend on Wednesdays, but all these appointments can definitely be made at our website, so we encourage you to chat with your son, your daughter, your family member to figure out what their needs are. We have our sexual health program. We really do a lot of education and awareness around different types of STIs, so students do make appointments with us to talk about that. And then we also are home to the Stall Seat Journal. The Stall Seat Journal is in 1,400 bathrooms across campus, and it's really a social norm marketing campaign to talk about holistic health education across campus and some things that we're seeing. We are also a JED campus, and that really looks at our entire VCU community and really putting a heavy focus around mental health education. This coming probably in the next 2 weeks or so look out for it. We'll be offering health coaching sessions. It will be free of charge to students to really give them assessment of where they are holistically, what are some resources that they can tap into, and then how can we assist them. Lynanne, can you go to the next slide, please? So ways to engage with the well. Ways to engage would really be looking at things across campus that we do, such as our health hut. This is actually a drawing that one of our graphic designers did, and it's an actual image of our health hut that we take across campus to put on different programs. And then also every Wednesday, we have a podcast called What the Well, and our staff members and some of our students are giving out information. The last one we just did was on alcohol and drug education. People can subscribe to it through their Apple devices, through their Android devices, or any other platforms that you listen to podcasts on. So our Resilience Lab, we did just open it. We have had a lot of students go through it. They're really building out those mindfulness techniques, and we're collecting that data to help them throughout the process. And so sometimes we'll see students for 3 or 4 sessions as they're building out their resiliency and figuring out some stress management techniques for them. The Resilience Lab is open Monday through Friday, 8 o'clock to 5 o'clock. They can come in for a one-on-one session with our staff members, or they can do it on their own, and we have some instructions for them. So we hope to see them at our Resilience Lab. So as we're wrapping up things and you guys are learning more about what we're offering with our health and wellness cluster with health services, university counseling services, and also the Wellness Resource Center, we would like to open the floor for questions.
All right, I've got some questions for you. Dr. Aziz, if you could tell me, if I have a student who is already in therapy at home, what would be the best way to get a referral from your area for them to continue therapy services somewhere nearby VCU?
Yeah, you would contact our office and we would connect you with our clinical case manager, Caroline Caulfield, and then she would be able to connect the student with a local resource or community provider. We mapped out busing routes. We know all the therapists within a certain radius. We have information about insurance. So we can help facilitate that, getting the student connected by them just giving us a call, and then we can work it from there.
Awesome, thank you. Margaret, can you tell us how important is it to get a flu shot?
Oh, very important. It's one of my favorite topics, as you all know. We're probably the only university in Virginia that actually offers free flu shots, and they're free for both full-time and part-time students. It's important for people who have certain health conditions, including asthma, to help prevent complications from flu. But the other thing that's important about it is that it protects others. The more people we immunize against flu, the more protection we'll have. It's called herd immunity. We're basically trying to be sure we have as many vaccinated people so that the unvaccinated people are less likely to be exposed to influenza. The CDC did a study a couple of years ago, and they found that in young, healthy people who got a flu vaccine, there was a significant reduction in missed time from work, and that would certainly apply to classes as well.
Thank you. Lisa, you mentioned that there is a really cool journal that's put in the different bathrooms around campus, the Stall Seat Journal.
Yes.
Can you tell me if parents and family members can access that online? Can they see what we're kind of pushing out to the community?
Absolutely. Parents and families can access that online by going to thewell.vcu.edu. And at the top left-hand corner, if they click on Stall Seat Journal, you'll be able to see previous stall seats and then also our current stall seat. We do one once a month, and some editions we do twice a month. So it's really important to keep engaged and kind of know what your son or daughter or your family member is really seeing on campus. And then also, too, it gives you a topic of discussion because the Stall Seat is one of the most read publications at the MCV campus and the Monroe Park campus. And so as long as you go to the website, you can access it for free. And if there's something that you want to see in our Stall Seat Journal that we're not promoting or pushing out, please email us and let us know.
Great. All right, I think I've got one more question for each of you. Coming back to you, Dr. Aziz, can you tell me, I saw on one of your slides that your office provides resources for LGBTQIA students, and I saw the word Safe Zone. Can you tell me what that is, what that means?
Yes, well, Safe Zone is a training that we provide for faculty and staff across the university. Part of our mission or our goal is how do we create a welcoming environment for all students, and specifically LGBTQI+ students. So we want to train them to how do they be sensitive, be aware, talk about pronouns, understand the struggle that students are going through and provide as much support as we can. Because we think, if everybody's involved, then we create an atmosphere that everyone can be successful. We also have what we call as a rainbow group, which I didn't have on there, which is a support group for LGBTQI+ students who can participate in. So we try to provide a lot of resources to lots of different groups of students on campus. You know, diversity is important at VCU, so we want to make sure we do our part to ensure that students are having a good experience at the university.
Great, thank you. Margaret, you talked about how full-time students have access to university student health services by paying their health fee. Do part-time students have access to health services?
Absolutely. They pay the semester health fee, and then they can access the clinic for the full semester. This particular year, the health fee is $112 per semester.
Great, thank you. And then Lisa, my last question is, if I have a student who is just super gung-ho about helping people be healthy and get out into the community and doing outreach, how would my student find out more information about being a peer educator with your office?
Yes, they can go to our website at thewell.vcu.edu and then click on Health Education and find the Peer Health Education tab. Or they can email Carrie Baines, as she's our Peer Health Education Coordinator, and her email is cabaines, BAINES, @vcu.edu. And that way she can also pair them with a peer health educator so they can learn more about it, because as we know, peer-to-peer education works best. It's a program that we're looking to continuously grow, and so we're always looking for more students. And so please reach out to us, ask us questions. That's what we're here for.
Great, thank you. All right, everyone, that's all we've got for you today, but I want to encourage you to join us for our next webinar, which is going to be taking place on October 29th, again at 11 a.m. We're going to be meeting with a colleague from Career Services, actually the Director of Career Services, and she's going to be speaking with us about how to get the offer when it comes to job and internship searching with Career Services. So we hope that you'll join us and maybe take away some tips for your RAM as they're beginning to seek out some of those opportunities. Have a great rest of your day, and we'll talk to you again soon.
Thanks.
Thank you.
Thank you to all of our presenters.